Okay, so welcome and thank you all for joining us this afternoon or this morning, wherever you may be joining us from. As you may have seen a little bit, if you could just enter your name, city, or the organization you're with in the chat box, that would be great to see where you're joining us from. My name is Christina Kane, and I am excited to share with you today the Healthy Brain Resource Center. And some updates for those that may not be necessarily new to the Healthy Brain Resource Center. I'm joined by my colleague, Jen Mezzo, who will serve as today's tech lead. So please feel free to reach out to her if you have any questions or tech issues behind the scenes. So to get us started, I want to kick us off with a poll and see who on the line has heard of the Healthy Brain Resource Center. And I'll leave that open for a couple seconds. And no worries if you haven't, you're in the right place. So please don't be shy to say if you haven't. Okay. All right, it looks like most have taken it. So I'll share those results. Okay, so it looks like the majority has heard of it. So great, we will share some new things on the horizon at the end of today's session. And then for those that haven't, you are in the right place to hear about and learn about the Healthy Brain Resource Center. So we are so glad to have you with us today. Just a quick note that the contents of this event are the responsibility of the authors and do not necessarily represent the views of the CDC or Health and Human Services. Before we get started, I'd like to share a few housekeeping items of note. Today's webinar is 60 minutes. The session is being recorded and will be posted on the Healthy Brain Resource Center landing page for anyone that is unable to attend or just to use as a resource for you to go back to and review as needed. You are automatically muted when you joined to keep background noise to a minimum. However, please, we encourage you to come off mute during any Q&A portions. And if not, if you just would like to prefer to use the chat, feel free to do that as well. At the end of today's webinar, we will provide a link in the chat box to a 3-question feedback survey. We ask that you please provide any feedback about the quality or helpfulness or any other aspects of today's webinar. We do appreciate your feedback and we'll use it to improve future webinars and trainings. The feedback survey will remain open for 1 week following today's session and close on October 5th. So we will send you an email following the webinar that will include links to the feedback survey and a Healthy Brain Resource Center user manual that I will talk about a little bit more later on. During today's session, we will introduce you to the Healthy Brain Resource Center, show you how to access and navigate the Healthy Brain Resource Center, how to submit resources and suggestions for consideration to the Healthy Brain Resource Center, and highlight new resources and functionality, again, on the horizon. And after today's session, we hope that you'll be able to describe the purpose of the HBRC, know how to access it, how to conduct searches in the HBRC, know how to submit resources for consideration, and recommendations and feedback for us to consider. Okay, so what is the Healthy Brain Resource Center, or what we also call the HBRC? The Healthy Brain Resource Center is an easy-to-navigate website that helps users find credible information and materials in the public domain to support implementation of Healthy Brain Initiative Roadmap Series actions. The HBRC serves as a centralized clearinghouse of existing resources from federal, state, local, and tribal agencies and organizations, national nonprofit organizations, academic and research institutions, and the private sector. Centralizing these resources in one place makes them easily accessible and will help state, local, and tribal public health agencies to plan and implement effective strategies to reach their program goals. The HBRC was developed again for state, local, and tribal health agencies, as well as other organizations interested in implementing roadmap actions. So what can you find on the HBRC? The HBRC offers easy access to materials such as how-to guides, toolkits, video tutorials, reports, fact sheets, and other reliable resources. Search results will provide users with a snapshot of each relevant resource, including the title, the source, the year of publication, as well as a brief description of the resource and the hyperlink to access it. Currently, there are over 150 resources in the HBRC, and in the next few weeks, another 130 or so will be added. Okay, so how are the resources added to the HBRC? The HBRC project team identifies resources for inclusion on the HBRC through an environmental scan of peer-reviewed and great literature from local, state, tribal, and federal government national organizations. We've also received recommendations for resources from recipients and subject matter experts. The HBRC project team reviews and codes each resource to determine whether it meets the criteria for inclusion on the HBRC. For a resource to be eligible for inclusion, it must be published in English within the past 10 years, be accessible for free via public website, or available at no cost by signing up for free membership, provide guidance or support for implementation of one or more of the HBI roadmap actions. Eligible resources are then vetted by CDC and subject matter experts and practitioners in the field. Resources approved by these groups are then included in the Healthy Brain Resource Center. So here are some updates to the HBRC this upcoming year. One of the changes moving forward is that the HBRC project team will now, our hope is to now conduct quarterly scans to identify new resources for inclusion to the HBRC. Whereas before we were doing biannual. We will continue to conduct an annual gap analysis to identify gaps in resources, broken links, outdated resources, and then to help inform and focus future scans. So before moving on how to access and navigate the HBRC, I just want to pause for a moment and see if there are any questions regarding what you can find on the HBRC or the process for adding resources. So please feel free to come off mute or type questions in the chat box. Okay, no problem. It doesn't seem like there's any questions. If anything comes to mind as we move forward, please feel free to leave that in the chat, and Jen and I will make sure to address your question before ending today. Okay, so next we're going to do another poll before we move on. We want to know who on the line or who has visited or explored the HBRC. Great, it looks like most people have answered. And it's almost a 50-50 split for those on the line today. About half have visited and half haven't, and that is okay. We'll show you how to access the HBRC. And one more quick poll, just to see for those that have visited, how frequently do you visit or use the HBRC? Daily, weekly, monthly? Okay. And it looks like people typically visit the HBRC or access it about once a month. Okay. So now that I've told you about the HBRC, I'm sure you're wondering, how do I get to the HBRC? For those that haven't been yet, where is it, or how do you access it? So there are multiple ways to access the HBRC. The HBRC is a public-facing site, and it is available by going to CDC's Alzheimer's Disease Program homepage and clicking the Healthy Brain Resource Center button, as highlighted on your screen, inserting the direct link into your web browser, and conducting an online search. In a little bit, my colleague Jen will drop the direct link in the chat box. And once you've had an opportunity to access the site, or if it's your first time, please feel free to save it as one of your favorites. The HBRC is compatible with any internet browser, Chrome, Firefox, Edge, etc., and on your cell phone or tablet. So let's go ahead and check it out. We will switch over to the live site. Okay, Jen or Danielle, can you see the Alzheimer's page?
Yes.
Okay, great. Thanks. Okay, so from this page, from here, as I mentioned, you currently on the Spotlight text box, you can access the Healthy Brain Resource Center here, but just note that things are updated or changed periodically in the Spotlight box, so it may not always be there. And so if you scroll down a little bit, as the screenshot showed on the previous page, you can access the Healthy Brain Resource Center landing page here. So we'll click on that. And this is what we call the Healthy Brain Resource Center landing page. And here there are a couple of resources below the HBRC user manual. I'll reference that a little bit later, the roadmap and the roadmap for Indian country. And so you just click on enter the HBRC and it takes you to the actual library. And so to search for resources, you can enter terms. Let me get a little pointer here. Okay. You can enter terms in the search the HBRC open text box. You can click on headers in this left column over here to find specific topics. And then you can filter down and check the boxes to filter your results. And then once you have those results, you can filter them by title in ascending and descending order, by the source, or by the year. Okay. And then I just want to highlight here again, just show you a little bit around that. The site does function, the search feature, as an and not or. So if you search under roadmap topic caregiving and select P for develop policies and mobilize partnerships, it's going to pull or return all resources that are coded as that. But then if you also select E for educate and empower, it narrowed the search down. If you saw, it went from 40 entries down to 31, because now it's going to pull all resources that are coded or tagged as both P and E and not one or the other. So just keep that in mind as you are filtering and searching, and you may select up to as many filters as you would like. So the roadmap topic and domains are a search feature. We have resources coded by population of interest, by social determinants of health, by language. And here I just want to note that, again, one of the inclusion criteria is that all resources must be available in English. And so that is a default. And then if you were to filter by Spanish, then it's going to pull up those resources that are also available in Spanish. And then you can also filter by resource type. Another thing I want to note here, because there seems like quite a bit, is that every single filter listed does have at least one resource associated with that filter. So you will not see a filter here, click on it, and then get no resources in return. So everything listed does have a resource to go with it. Okay, I also want to show you, let's just open up a resource. So here, a public health approach to Alzheimer's and other dementias. As I mentioned, a kind of snapshot of the resource appears when you click on it. It gives you the title, the resource link, a short description of the resource, and then the associated filters or parts of the resource. So roadmap and topics and domains are all listed that are covered within this resource, the population of interest, and the resource type. And again, English is the default. It will say Spanish if it's available in Spanish. And I can click on it just to show you. When you do that, it takes you directly to the resource. And then here you can read, print, PDF, however you need to access the resource. Okay, just to show you another one. Again, see here, the title, the link to it, and again, a quick description of the resource, the type of resource it is, and then if you click on it, it takes you to the resource. And the same if we filter by Spanish. Currently, there are about 13 resources available also in Spanish. And I know in the next scan, there are quite a bit more that are offered in Spanish. So that should definitely bump up in a couple of weeks. And the same thing, if you were to click on it, it lets you know that it's in Spanish, available in Spanish. Yep. There you go. Okay, let me just check the chat box and see if there are any questions. Okay. Are there any questions right now about how to navigate or search on the HBRC? Okay, and Jen has dropped the link to the HBRC in the chat box, so go ahead and save that when you get a chance to. And there is another poll we'd like to see. Yeah. Okay, for those that have used the HBRC, do you find the resources helpful? Has it helped you, or did you find the answer you were looking for? And we'll leave that open for a little bit. And don't be afraid to say if it doesn't. There's always room that we can improve or help to get you what you would need so that it would be helpful. Okay, so everyone did say that it was helpful, so that's great. We're glad to hear that. Okay, one other thing that I want to, thanks Amanda, appreciate that. One other part on here that we do want to really highlight is how to submit a new resource. Again, in addition to our environmental scan, we do receive resources from recipients, from subject matter experts and others in the field. And so we really would encourage and appreciate if you come across a resource that may not be in here, but was really helpful to you or that you think should be added, please feel free to submit a new resource, and I'll show you how to do that. You click on submit a new resource. It will take you external outside of the HBRC to a Google Doc form. And then it will ask you for some information. There are 11 fields, but only about 6, I believe, are required. So the title of the resource, a link to the resource, which road map topics are associated with the resource, and then if you could just provide a short description. And this really is 1 to 2 sentences that say, whatever the resource may be, this brief, this report, this fact sheet, or this FAQ, provides information on XYZ, and we can help refine those if need be as we receive these. The source, the year of publication, those are not required fields. Populations of interest, and social determinants of health. So I can go ahead and let's just populate one really quick. Just so I can show you what it looks like on the last page of the form. Okay. And once those required fields are complete, again, if you know the other information and want to provide it, great. If not, no worries. You click next. And then your first name and your last name. And the only reason we ask for this information is in the event sometimes websites or wherever you received the resource, the link, websites are updated or changed, and so then it changes that URL. And if we aren't able to access the resource, we'd like to be able to get in touch with you to get an updated link or resource. So once you do that, you click submit. And then here you can print or PDF your answers just kind of as a receipt, or if you have more than one resource you would like to submit, you can just click on submit another resource, submit another response at that time. Okay, any questions about how to submit a resource for consideration? I wait for anyone to see if they want to do that. I also just want to note that once resources are submitted, that they do have to go into the normal queue of being reviewed by CDC, and if they're not federal, external review process. And so just allow a little bit more time for those to go through that process before they are added to the resource center. Okay, and then I do also, if anyone is on the line from the previous webinar, thank those that have submitted resources for consideration. We will get those in the next scan. And now that we have, our hope is to move from the biannual to quarterly scans, we do hope to just keep more content, more frequent content and fresh content on a more regular basis. Okay, let's switch back. Presentation. Okay. And Danielle, just holler if you can't see, but we're back on the presentation now, and the next few slides are just kind of screenshots of the live demo that we just conducted. So that way, if you ever want to refer back to just the slides, you'll have those pieces as well. So again, these are just the ways to navigate and search and filter through the HBRC, how to submit a new resource. And there's shows you the steps in the form for that. Okay, so next, I would like to show you the Healthy Brain Resource Center user manual. So let me pull that up. Here we go. So this document, here, this is the Healthy Brain Resource Center user manual. And this document really is just a guide for users of the HBRC. And it includes general information about the HBRC, guidance on how to access and navigate the HBRC, and how to suggest those resources for consideration and how to submit those. The table of contents is hyperlinked, and so if you want to just jump to a section, you're able to do so. So in it, we've included a glossary of filters, so it just jumped right down to the bottom of that, as of the guide, as you can see, and we have some definitions of the different filters in the HBRC. This document, as I showed when we first started the live demo, does live on the HBRC landing page. I can show you that again really quick. Right here, which this page can be accessed from the Alzheimer's disease homepage. Okay, and then as I mentioned, it's kind of just a mirror of what we went through on the live demo portion. It tells you what the HBRC is, who should use it, what does it have to offer, how to access it, some links to get to it, and then how to navigate once you're there, and then submit those resources for consideration. Great. Okay, thanks, Jen. Jen has dropped in the user manual, a link to that as well. And then our email, if you have any questions about the guide or the HBRC. Okay. So next, we just really want to encourage you all to submit any recommendations and or feedback about the HBRC to that email that Jen dropped in the chat box. And it really can be about any of the resources, your experience using and navigating the HBRC. Again, this is your library, and we really want it to be useful and meaningful and helpful to you. So again, we will use any feedback that you provide to us to just help inform our scans, our searches, enhancements to the HBRC, to the guide. Again, we want it to be useful and helpful to you. I just want to know in the chat box, or feel free to come off mute, are there any other types of resources that would be helpful to you or to see in the HBRC? Okay, great idea, Mandy. As you dive in, and Mandy shared that she'll have to explore a little bit first. But once you dive in and browse around a little bit, we'd love to hear your feedback. Okay, so as I just mentioned on the last slide, we do appreciate any recommendations and feedback. And as a matter of fact, from the previous session we had, we've received a recommendation to add a filter to the HBRC that allows users to identify location-specific resources. Or resources by states, territories, tribes. So to add that filter. And so during our next year, we will be working to add that filter option. Again, I mentioned a little bit before that we are working this year to scan and update, and our hope is to provide new content on a quarterly basis so that we will have new resources available more frequently. So again, in the next couple of weeks, we will be adding over 130 resources, and hopefully by the end of the calendar year, another batch to add as well. And this upcoming year, we are very excited also about some new resources that we will begin working on. We are planning to add Alzheimer's state jurisdiction plans to the HBRC, as well as stories from the field, to really just share and highlight all the great work that you and your peers are doing. We would also like to explore additional ways to obtain feedback about the HBRC. So this may include us reaching out to some of you via email, phone, or small focus groups. So be on the lookout for those opportunities. And again, we really just want to hear you and make sure that this resource is helpful to you. So we have a question: how long does it take for resources submitted to be approved for the HBRC? So once a resource is submitted, again, our hope is to have these quarterly scans. So if a resource is submitted, it will go into that quarter's scans list of resources. And then if it's a federal resource, it just has to be reviewed and approved by CDC. And if it's a non-federal resource, in addition to CDC's review, it does go through an external review process. So it takes an additional couple of weeks. So hopefully resources say that are submitted in this quarter, you will see live in the next quarter. So let's just say, to be safe, give yourself a 3-month window, but depending on when you submitted it within that quarter. If it came at the tail end, then you'll see it sooner. Hopefully that helps. Let me know if you'd like me to clarify a little bit. Thanks. Any other questions? Okay, so as I mentioned early on, we are capturing some open-ended feedback about today's session. Jen is going to go ahead and drop a link to that. I will also send out an email that will have the link for those that are on the session today or the webinar. Again, please provide any feedback about the quality, helpfulness, or any other aspects of today's webinar, or anything else that you'd like to share with us. I do just want to open the floor briefly to see if anyone has any other thoughts about what type of content that would be helpful to cover in any future webinars about the HBRC. Feel free to come off mute or type it in the chat or leave it in the survey. Okay, Jen or Danielle, anything else?
Christine, I was just going to reiterate what you said, which is that we truly value feedback. It doesn't have to be positive feedback. We're open to not so positive feedback as well. We really do want this resource center to be as useful and as user-friendly as it possibly can be to you all. So please don't be shy. If there's something that you'd like to see as a resource in the resource center that's not there, or some sort of functionality that would really make this a more usable tool for you, please don't be afraid to share that with us. We really do look forward to your feedback.
Thanks, Danielle. Okay, if there are no questions or just anything you'd like to share, I can give you about 20 minutes back to your day, and I'm sure we can all use that. Oh, you're welcome, Tammy. Thanks, Ebony. Thanks, Tina. We appreciate that.